Alright, kid, we're gonna ask you questions, you're gonna tell us the truth, and you won't get the stick anymore.
I'm sorry that I lied all this time. It's not just my tummy. My back's been starting to hurt too.
There we go.
Back pains. His condition must be getting worse. Roni, make a note.
Understood, Doctor. New symptom observed. Back pains.
It doesn't hurt so much that I can't bear it. It hurts a lot. Also, I don't feel well. I feel like I'm gonna throw up any minute.
That's another one, right?
Feels like he's going to vomit, huh? Sounds like he's finally telling the truth about something. Roni, this is important.
Indeed, Doctor. New symptom observed. Nausea.
I feel like we were gonna get somewhere now. Thanks, kid.
If there's anything more, I'll tell you right away, Doctor.
Doctor, I'm thirsty. Is that a symptom, Doctor? Okay. Think we're okay now. Do we need to go back and match up some more symptoms or something? I have a feel like maybe we missed a symptom or two, but we can at least work with something. Biliary infection. Okay, well... Should we check to see if he has a fever? I don't know. Where did all that other stuff I had before, like the lack of appetite, go? Should look to see if there's a jaundice or shaking, but I don't think I saw anything like that. And I didn't notice those, so I don't think it's this one. Okay, we got back pain. Nausea. This is looking close. High serum lipase level and high elastase level. Oh, and amylase. There we go. Calcification within the pancreas. That's different from swollen pancreas, I think. And we saw bowel gas, which doesn't mention anything here. I don't know. Acute pancreatitis. Pancreas becomes digested. Ugh. Back pain. Nausea. Blood spots. Should take a look at his stomach again. Intestinal bowel gas, and a swollen pancreas. We need to check for blood spots on his stomach. Yeah, let's check that. I figured he'd be alright, but maybe he changed over time.
Joshua, how are you feeling?
Joshua, do you got
all right?
blood spots on your stomach?
Oh, Doctor. Yep, I'm still doing okay.
That's a good boy. Just hang in there a little longer.
Do you have subcutaneous hemorrhaging? Tell me the truth, kid. Whoa. Hey there. Wow. I wasn't there last time.
Hemorrhaging spots on the left side of his abdomen. Roni, put that in his record.
Understood, Doctor. New symptom observed. Blood spots on left of abdomen.
I think we may have figured out what it is. And we have it near the navel as well.
Hemorrhaging spots near the navel. Roni, write that down.
Understood, Doctor. New symptom observed. Blood spots near navel.
I I think we may have figured it out. Good job, kid.
Well, we have his symptoms. Roni, let's narrow down our diagnosis.
Understood, Doctor.
Yeah, I didn't figure that he was going to change that quickly, visually. If we already performed a visual exam, I don't see how he could hide something like that. So you have acute pancreatitis, kid. Oop. Diagnose! Ah, it's just acute pancreatitis, nothing
I
bad.
find it hard to believe this could have caused the relapse of his gastric ulcers.
Oh, is there going to be a part 3?
Damn it. There's still
There's
something
still
else.
something else.
Roni, I'm continuing with the diagnosis. We're not done yet.
Indeed, Doctor. I will follow your lead.
Acute pancreatitis? That can't be the primary disease.
It is plausible the chief illness caused it, like the ulcers.
What the heck's going on?
We can only hope our examination will answer that, Doctor.
Yeah. I hate dealing with all these complications.
It's just like regular trauma center. If there's tumors, that means that something's bad. Like that's how you tell the level of badness in a patient is how many tumors they have.
So have you figured out what's wrong with me, Doctor?
It's going to take a little longer. We need to keep examining you. But is your body all right?
It still hurts a little. But you're gonna fix me soon, right?
That's right. Hang in there. But if it gets too much to handle, you tell us right away, okay?
Okay, I promise.
All right. Let's resume with the diagnosis.
Okay. What are your new answers?
Anything else that's weird? I'm not hiding anything anymore. I started getting real
Thirsty.
I've been going to the bathroom a lot too.
There we go. That's what I needed to know, kid.
This is polydipsia and polyuria.
I'm assuming urea has to do with using the bathroom, and dipsia has to do with being thirsty.
It's small, but it's crucial. Roni, make a note.
Understood, Doctor. New symptom
You could just be
observed.
thirsty from all your lying, kid.
Polydipsia and polyuria.
That's it. Is that important? It's kind of embarrassing.
There we go. Dang, kid. Alright, any new numbers? Just kind of speed through this a bit if I can. The serum calcium is higher. Oh, I didn't know you could do that. Oh, that's kind of cool. Anyway, yeah. I think that number's high.
His blood calcium is way past the average levels.
In fact, I remember seeing something about that in one of the other symptoms.
Roni, you got that one?
Yes, Doctor. New symptom observed. High blood calcium level.
And I think the phosphorus is low. Cool.
His serum phosphorus level is abnormally low.
And why did this just occur in the past, 5 minutes?
Roni, another piece of the puzzle.
Understood, Doctor. New symptom observed. Low serum phosphorus level.
Also, that serum PRL level is too high.
Yep, abnormally high PRL blood level. Roni, mark it down.
Understood, Doctor. New symptom observed. High PRL blood level.
It just happened so fast. That was the biggest problem, I think. And your serum gastrin, what is that? Pancreas, bile duct, yeah, that looks about right. That's high. That's actually really high.
The serum gastrin level seems unusually high. Roni, record that.
Understood, Doctor.
You just got all sorts of things wrong with your blood now.
High serum gastrin level.
And your intact Pt.2 level is abnormally high. Abnormally high.
His intact PTH is showing some very high levels. Roni, put it in his chart.
Understood, Doctor. New symptom observed. High intact PTH level.
What in the heck? A number of abnormal levels have suddenly
Yeah, I know, right? They weren't here 5 minutes ago?
The cause is unknown, but the analysis is at least 97% reliable.
I know. That's why I'm worried. Let's go back to my office. I need to sort through the latest data.
Don't worry, kid. There's not a whole heck of a lot of things wrong with you or anything. Don't worry. At all. Just stay calm.
Now, time to narrow down our candidates and see if we can't find the culprit.
Let's see, what could you have? You could have... Oh, we only got two. Hyperparathyroidism and then acute kidney failure. I was actually thinking something to do with the kidneys because he had all those blood problems. And kidneys are the ones that filter that. So I feel like it might actually be the kidney failure. Of course, I don't know much about thyroid. Polydipsia and polyuria. High blood calcium level. Low serum phosphorus level. High intact PTH level.
A number of symptoms which don't apply. But hyperparathyroidism seems to be the closest match, right?
Really?
Scintigraphy and X-ray examinations will be necessary to make a definitive diagnosis.
Well, then let's get approval right away.
Okay, maybe it is hyperparathyroidism.
Understood, Doctor. Request has been approved. The X-ray and scintigraphy exams are now available.
I love scintigraphy exams. So it wasn't acute kidney failure, really. Ah, yeah, look at that. We got itchiness, nausea, dizziness. Yeah, he doesn't really seem to have those. So it might actually be hyperparathyroidism. Let's go check out your images.
Doctor, the X-ray and scintigraphy results are ready for your review.
Sounds
Cool.
good.
Let's get to it. Ah, just two to work with. Good, I can work with two. Why have his hand? Does that have to do with thyroid? I guess I wasn't paying much attention. Maybe there was something going on. This is a pretty simple image. And as far as I can tell, I mean, no, that's about right. Scintigraphy, how about that? Patient's head and chest. Oh, I see, that's the head, and there's, oh, I think, these are like some sort of glands, right? Technictum. Well, very obviously, you've got an extra concentration of technictum right there.
Showing abnormal accumulation of technetium in the parathyroid
Technetium
gland.
in the parathyroid gland.
There's no mistaking it. It's parathyroid adenoma.
Understood, Doctor. New symptom observed. Parathyroid adenoma.
Well, that's good. Now, what were we supposed to look at in his hands? I don't on, let me go look at what the symptoms could be again. See if I need to.
Sounds
Yeah, I know. It might give me a hint as to what I need to look at. Subparadisal bone resorption on the thumbward sides of the index and middle finger. Okay. Abnormal accumulation to the parathyroid adenema. So we need to look at, let's see, thumbward side. I need to figure out if that's a right or a left hand that was up there. And index and middle fingers. Let's do a quick check for that.
sounds
Okay, what do we got? We've got a right hand, so thumbward side. So we're looking for on both the middle and the index finger something to the left of them. Honestly, I have no idea. No, nothing.
throwing me off my pace.
Oh, I'm a bit confused. I don't really understand what that means, and I mean, to me, these look absolutely identical. Especially considering the middle and index finger. They look exactly the same to me. Is there anything left in the scintigraphy? I don't think so. It's just that one spot. Something down there, but that's the same. Oh, X-ray. X-ray, please. Actually, now that I look at it, is the index finger the pointer finger? I thought the index finger was the finger between your pinky and your middle finger. Is that not the index finger? Regardless, I'm now starting to notice that there's a weird shading on this finger right here.
Bones in his fingers have gotten thinner. His bone resorption must be advancing. Roni, add this to our list.
Understood, Doctor.
Why'd you hide your subparadisal bone resorption, kid? Everyone knows subparasteel bone resorption when they see it. Bunch of punk kids, these are. Alright, we figured it out. You've got hyperparathyroid something.
It's pretty clear that hyperparathyroidism has set in. But what about the symptoms that don't apply?
Like what?
Until the primary disease has been identified, we must continue the diagnosis.
Yeah, no turning back now.
What other things? Serum oh, you mean there's extra symptoms that we have? No, they don't match? I didn't think they did. Should we go through acute kidney failure? I don't think anything matched. that's just the exact opposite. I don't know. Do we need to go back and talk to the kid, maybe? That would make sense. Joshua, what are you hiding again? You got extra symptoms.
Joshua, are you all right?
Huh? Oh. When did you come in, Doctor?
You didn't notice?
Something's weird. It's like I can't see very well.
And you didn't bother
Can't
to
see
tell me?
very well? Can you tell me more?
Uh-huh. Okay. I really didn't see you come in, Doctor. I mean, it's weird, right? The door's right there. But I totally didn't see when you came in. And my head hurts too.
I'm gonna give it a shot.
He must be undergoing a visual field loss. Joshua, where is it hard to see? Is it the right and left edges of your eyes?
Huh? Oh, I think so. I can't see right and left.
Just as I thought. It could be in the eyes. It could be in the brain. We
Uh-oh.
need to do an MRI.
Well, that's bad.
Understood, Doctor. New symptom observed. Visual field loss. And the MRI exam is now available.
Maybe you just have a lot of things wrong with you. Maybe you have like two symptoms. You have two things going on. And your head hurts.
Stomach aches, back pains, and now headaches. This has to be hard on him. I need to find the answer quickly.
I agree, Doctor. New symptom observed. Headaches.
Okay, yeah, let's check out that MRI.
Doctor, the MRI examination results are ready for your review.
All right, let's check him right away.
Okay. Oh, good, we got loads of I hate these things. I can't ever tell. They make people look like weird chickens without beaks. Yes, I got it. Is there something wrong with your brain, kid? It looks squishy. I'm gonna focus more on the brain area than anything else. Just because that seems like the most logical here. Okay, looks alright. It's so washed out, it's kind of hard to tell much from it. Is there something, hold on. No, not 4 or 5. What am I supposed to be looking for? I'm a bit confused. That's all the MRIs, right? It's 5 of them. Let me take another look through them. I think I may have found it. I think I may have found it. So I was looking for quite a while, and I finally noticed that, well, there's one tiny difference here. This little white thing here, this like white tube thing here, it's smaller here. There we go. I think.
Huh?
Is that it?
Pituitary gland's gotten so large.
Yeah, your pituitary gland, kid.
No question. This is a pituitary gland tumor.
Pituitary.
Understood, Doctor. New symptom observed. Tumor shadow on pituitary gland.
There you go. Is that it? Is there anything else? Honestly, I was looking for so long, I wouldn't be surprised if that was it. Is that it? Sorting through the symptoms. Okay, yeah. That did legitimately take a good bit of time. I mean, that was... wow. Alright, what do we got now? Something wrong with this kid's brain. We already found hypothyroidism to be probably right. Not acute. Let's see, pituitary adenoma. Headaches and vision loss. High serum PRL level. And then we got tumor shadows.
Huh?
Well, that matches.
All the symptoms seem to point to pituitary adenoma? First, the parathyroid gland, now the pituitary gland. Damn it, what in the world?
Doctor, I have located one case in the archives which matches this scenario.
Ooh.
What? I didn't tell you to do that. How'd you...
I applied the "to hell with that" algorithm recently entered into my registry and made a judgment call.
Huh? The apple doesn't fall far from the tree, huh? Even a robo-apple. Now, this is the kind of partner a doctor should have at his side.
Yes, Doctor. I have indeed been designated as your partner. But the news is not good. This is a disease where the probability of onset is 1 in 10,000.
Oh.
Where is it? Show me the data immediately.
Yes, Doctor. I have added this diagnosis candidate to your database.
Got it.
Okay. What is it? Wermer's syndrome, is that it? Or was it something different? Anyway, we'll go through the rest of them. Attacks of epilepsy, paralysis, sensory disturbances. This doesn't seem like it. We've got vision loss. Yeah, I don't see that. I'm liking this music. It's still kind of like, it's weird, it's still kind of a chill feeling, but at the same time you got this weird urgent, like, we need to start, we need to move. Something bad is going to happen. I like it, this is really nice. Damage to the optic nerve. We got vision loss, headache. I don't think that's it. Optic neuritis. We got vision loss. That doesn't seem like it either. This one has a lot of symptoms. It might actually be it. Multiple glands in the endocrine system, such as the pituitary gland, parathyroid gland, and parotid gland. Oh, that's sounding a little bit like what we've been running into, isn't it? We've got headache, vision loss, polydipsia and polyuria, high serum PRL level. We got a high blood calcium level. Oh, no, that was phosphorus. Calcium. High intact PTH level. And high serum gastrin level. Oh, this is bad. This is matching pretty well. Let's see. An X-ray exam will reveal subparadisal bone respiration in the fingers. Tumors in the pituitary gland can be confirmed. And scintigraphy will confirm the abnormal accumulation into the parathyroid adenoma. Well, there should be tumor shadows on the pancreas in a CT scan. They'll be very small and difficult to discern with an image analysis. We still probably need to get a pancreas CT scan,
Werner
right?
syndrome? That's impossible.
And why?
I must disagree, Doctor. The probability of this match is roughly 73%.
To verify this, we need to check for pancreatic tumors. Roni, order a CT scan so I can examine the patient's pancreas.
Dr. Cunningham, should I also request that the patient be assigned to another doctor?
Don't make me repeat myself. I don't pick and choose my patients. I'm a diagnostician. I find the symptoms, I diagnose the disease. That's all there is to it.
Understood. The CT examination is now available.
And it said it's going to be kind of hard to see, so that one ought to be fun. I had a lot of trouble with the last one, and I wasn't told it was going to be hard to see.
That's good.
This has got to be worse. Let's see. Oh, good. We got 5 CTs as well. This one might take me a while as well. That's unfortunate. I wish at least I knew which one is the pancreas so I could figure out where to concentrate my search efforts. It said they would be small and hard to see, and I've got 5 whole images to look at. See, I see all these like tiny little dots on these other things and I think they're wrong, but then I look and they're like, oh no, it's okay. Is that it? Whoop, hold on. Oh no, that's normal. I saw a weird star thing over here, I thought that was wrong. Oh, but that's wrong. No, image 4. Right there, the patient's got a small, like, dot there. I'm pretty sure that's a tumor.
Huh. I guess that's that. These shadows look like pancreatic tumors, all right. Roni, I need to make sure of this. Collate it with the case data.
Understood. Now collating. 9 matches with previous cases confirmed. These are pancreatic tumors.
I see. I think for once, I'm not so excited about your accuracy.
New symptom observed. Tumor shadows on the pancreas.
Ow. Well, that's that, is it? I think we just about figured it out, haven't we? So what's the kid got? Werner's syndrome. Wermer's syndrome. You got Wermer's syndrome, kid. Do you even know what a wormer is?
The diagnosis. Well done, doctor.
This needs to be dealt with at once. If his condition worsens any more...
You got worms in you, kid.
Damn it!
This is bad, Gabe. Joshua's only getting worse.
It's Wermer's syndrome. He's going into septic shock. I'll leave the treatment to the other staff.
What? Joshua's your son. Get over there and go see him.
Me going there won't change anything. I gave my diagnosis. The rest is up to you guys.
Huh? You are an absolute disgrace!
You are incorrect, Dr. Cunningham.
What?
I observed tension in your vocal cords just now. Your words are not congruous with your true feelings.
And what? You mean you can tell everything about me?
Uh-oh.
Am I that wrong? Is everything my fault? I can't make him happy as a father. I can't use a scalpel and save him myself. There's nothing I could do! Nothing, damn it!
Doctor, you appear to be agitated. Will I dream? Doctor?
It was all pointless. Everything. Hey, Roni. You know what? I'm the worst father out there.
Dr. Cunningham, do you truly feel your work is pointless?
Huh?
There is one thing that is unclear to me. All people die, so medicine is ultimately pointless. But doctor, I have observed
Well, what do you know? You're right. I can't believe a machine talked some sense into me.
Doctor, you're paying for my damages.
Roni, get ready for surgery. Contact the ER and nursing.
The operation can begin in 5 minutes.
I won't let Joshua die. As a doctor, or as his father. Let's go.
Oh, I hope we have him as an operating assistant for when we eventually have to operate on him. That should be fun. Simplest truth. Well, that ought to be fun. Today wasn't too long. Kind of see where we're gonna probably be heading. Well, I don't want to go any farther in his story. Like, I don't want to go any farther in his story because I feel like that's going to be a surgery we need to do at some point. And I don't want to go too far for that. I've already done Dr. Kimishima's mission, right? So, should I go and focus on CRSO1? That sounds like a reasonable idea. Or should I focus on everyone but CRSO1 and leave him for last? Since he, I guess, is going to operate on a lot of their people, somewhat. I don't know. If you've got an idea, give me maybe an idea from where to go from here. I'm a little bit stumped. I don't want to continue with Gabe unless that seems like a good idea. Just because I think we need to operate on Joshua first before we continue with Gabe. Because if you saw, there was a pretty big gap there. Like, we just did the simplest truth. And there's a pretty big gap there where I'm pretty sure somewhere over here we operate on him. Somewhere. Anyway, thank you guys for watching, and I'll see you next time for some more Trauma Team. Bye!